principle here. The first one, health care is a basic human right, and we fight for basic human rights. We know what the goal is, at least for our team, and that is everybody gets access to good health care at the lowest possible cost. That's what we're aiming for, and Medicare is the best way to do that. So I support Medicare for all. So, what do we need to do? Let's just do this one really quick. First thing we need to do in the next year and a half, we've still got to protect the Affordable Care Act. It's under attack. It's under attack in the courts. It's under attack in the agencies. They're doing everything they can to take the legs out from underneath it. People have lost access. And remember what this will mean. If that court decision goes through, insurance companies can discriminate against anybody with pre-existing conditions. Yeah, it means kids can get knocked off their parents' health insurance plans. It means that when somebody gets diagnosed with cancer, the insurance company can put a cap on how much they pay. So, part one, defend what we got. Part two, let's pick the low-hanging fruit. Reduce the cost of prescription drugs. Yes. Come on, you don't have to rewrite a system to do this. And how can we do that? For openers, we can import drugs that meet the same safety standards from Canada. They're often paying a whole lot less than we are. Part two, we can let Medicare negotiate with the drug companies. I have a proposal on generic drugs. Let me just ask, anybody in here take insulin or know somebody who takes insulin? Anyone with allergies so that you carry an EpiPen or know someone who does? High blood pressure medicines, right? Heart medicines, yeah. About 90% of prescriptions in America could be filled by a generic. And the whole idea behind the generics was they were supposed to be cost plus. That the drug company had already gotten all its profits in the first 6 years when the drug was still under patent, and the rest of this was going to be cheap, cheap, cheap. Insulin has been around for 100 years, and yet the price stays through the roof. So I have a proposal to say when you've got the generic drug market and it's not working because there's been a lot of interference from the drug companies, then the government can just let a contract to produce it at cost plus and make it available to people at cost plus. Yep.